Hi everyone, my name is Bryanna and I'm the manager of social media here at BioPro Armour. And I'm back again today with Dr. Warren for our weekly Ask the Vet series, where we tackle different vet topics or horse healthcare related topics. And today we were going to talk about sore backs because that's a pretty prevalent issue with horses, especially horses that are involved in sport. How are you doing today, Dr. Warren?
I'm happy. How are you doing, Bryanna?
I'm doing well.
Great. Wonderful. Have you been able to ride lately?
Yes, actually at my last lesson, I actually rode my friend's horse through one of the tests I memorized for the first time. It was a bit rocky, but I'm glad that we did it and we made it to the end, so it can only go up from there.
Wonderful. That's a big achievement.
Yeah. I've been working hard on getting him to respond to my aids because they're different from
Yeah, of course.
the average person. So
Yeah, no, that's great. That's
it's
wonderful.
been
Well, the horse is learning something as well.
yep, it's fun for him too.
Yeah, no, for sure.
My my trainer says that um she thinks he likes it. Well, he didn't at first because you could tell by his behavior that he was kind of like, I don't really know what's going on. But now that we've kind of gotten him used to it, he seems okay with it now. So
Well, they pick it up quick. They usually pick
yeah,
up things quick. When the first time is a little bit tricky, but
yeah,
the second time is better. The third time, by the time you're doing it 5 or 6 times, they're usually way ahead of us. They know
yep,
what's
yep.
coming.
I agree.
That's great. That's one thing about horses. They keep us nimble and on our feet. That's for sure.
Mm-hmm, for sure. I was thinking we could just go over sore backs, kind of like what causes them and how you would go about treating them generally, things like that.
Okay, great. Well, that's a big subject. Uh,
I
from
figured.
from the tail to the neck, that's a long stretch.
Yeah.
And at any one time, as you realize, a horse's gait, all of his weight is on one hind leg. The other three legs are suspended until the next leg hits the ground. So that's a tremendous amount of stress all the way up that leg to the joint surface, and the one that takes the brunt of it usually is what we call the sacroiliac ligament, which is the SI joint, where the right in the middle of the croup. So horses, especially horses that do a lot of fast, heavy duty exercise, like race horses, barrel horses, that stress is pretty exquisite on their backs. And of course, one of the main things that are a problem is bad horseshoeing, because the way the horse's
Yeah.
foot is behind, well, all four actually, but the angles of that foot are very detrimental if they're out of balance. So the feet have got to have the right angles and in balance, and that'll help the whole leg work a lot better. But then you have other pathologies up the leg. We don't have a lot of ankle problems. We have some split bone problems behind, and once in a while we get ankle problems. But the hock is the next joint up that has the major problems. We get there's three different joints there that are affected, and you get little bone spurs in either one of them. Two of the joints are so-called non-movable. The main hock joint, of course, is a major movement joint. So if you get any kind of uh, arthritis or inflammation in that joint, that affects the way the gait changes and puts some more pressure on the back area. And then we go up to the next step up would be what we call the thoroughpin or the whirl bones. And that is there's a ligament that comes over the top of the pelvis, and it has a bursa there, and it gets inflamed. And we used to inject iodine in those joints around the bursa to increase circulation, and it solved the problem about 90% of the time. So those are the major problems that cause back problems, other than also bad fitting saddles, of course, are a big problem.
Yep.
As you
Yeah.
can imagine. And of course, the way we sit on a horse, especially if you're a big guy and you're sitting way back you got your weight way back in the middle of the back, that puts a lot of pressure on that SI joint as well. That's usually where the soreness originates. But you can have long muscle problems. You get, you probably heard of kissing spine lesions, where the dorsal spine and the vertebrae touch each other and cause like an arthritis, and where those spines touch, they'll have inflammation, and sometimes that is overblown as far as the cause goes. I mean, we blame anything we see that's abnormal on sore backs, and that's a big catch-all. But sometimes it's not as bad as it looks. And but horses that have a sore back, they will not extend themselves, and it really causes a problem with their performance. It's a major performance problem. And backs start slowly. The other problem we have with backs is what we call tying up. Some horses have a affinity for tying up. What happens is all the muscles become like in a state of spasm, or it is very painful. They have a hard time moving their hind legs. They usually urinate with hematuria, have blood in the urine. And the drug ESE, which we used years and years ago, usually helps to eliminate that, especially in fillies. And also in fillies, a little testosterone sometimes will help that tying up syndrome, where the muscles remain placid and pliable, instead of having the ability to get tight and overreact. So that's another little problem. But I don't know how they're treated. I haven't been to the racetrack for the last year, so with HISA taking away all of our drugs, I don't know if they're able to use this or not. But that's a great drug. It has been in the past for me to treat.
Everything changes so much all the time.
Well, it's a combination of selenium and vitamin E, which are two nutritionals that sometimes become deficient in a horse. That's what causes the problem. So they're based on actual working on that SI joint, which is the biggest problem. I saved to last. We can take, usually it's done by ultrasound observation. We take a long needle and inject it down into that SI joint itself, and deposit some steroids, betamethasone usually, and try to cool that joint out. I very seldom do that because it can be really tricky. The guy really has to know what he's doing to get there, or if he can puncture the wrong thing and he ends up with a real big problem. But what I used to use was, here again, like with the whirl bones, I'd use a 2% iodine in almond oil. It causes a counter irritant, and I inject about 50 cc's in the horse, going from the middle of the croup up through the coupling and on to about another foot in front of the coupling. So there's an area that's on both sides of that SI joint about a foot each. And I'd inject 2 lines on each side, about 2 inches apart. Put a cc and a half, 2 cc's in each spot. And what that did was it caused a massive increase in circulation in the area and helped to decrease the inflammation and satisfy the pain of the horse. So they get very pliable afterwards. It usually lasts about a month, depending on where they're running. Here again, I left one thing out which causes bad backs. That's a cuppy racetrack too. The racetrack always has problems with it. If it gets to be cuppy, it's easy for them to take a misstep behind.
Yeah.
So the backs are very serious. We developed years ago, 1998, we developed a modality called PEMF. It's a pulse electromagnetic frequency. And it was a loop of copper wire, about the size of the loop was about, maybe 10 or 12 inches in diameter. And we ran 40,000 volts through that loop, and it caused a magnetic field about the size of a football. And we'd run that loop over the back area where the soreness was, and it did 2 things. It because of the magnetic field causing what we call electroporation, it opened up the cell membranes of those damaged cells, changed that sodium-potassium pump from sodium to potassium so that it decreased the inflammation and the pain in those cells. And that lasted for about 3 hours, the electroporation, but the effects of the anti-inflammatory and pain relief would last for, a good 24 hours, 36 hours. And we would treat these horses, if they're really bad, we treat them every day for a week or 10 days. Then we'd skip a day, go every other day, and gradually wean them off to where they didn't need it anymore. And we had great luck with that PEMF machine. It's being used today in a lot of racetracks and rehabilitation centers. And if it's used right, it's one of the most important tools we have to treat these sore backs. And additionally, it'll help you sometimes pinpoint a back area in the back that you can't find any other way, but that PEMF machine will pinpoint that where the problem is. And then last of all, we'll get the BioPro Armour.
Yeah.
BioPro Armour is as we know, and they've been trying to educate people, is a immune restoration and balancing product. And when your immune system is balanced and restored in its proper manner, horses heal quicker and more completely. And therefore, if you use the BioPro Armour along with on a routine basis, you might even help prevent some of these problems from happening. But at least you know that they'll heal quicker from the stress they're in of the heavy training they're going through, and also shipping from place to place, from event to event. That's the hardest thing on a horse we don't realize. And that causes great stress to their immune system. But we had a therapist that was using BioPro Armour routinely, nebulizing it. And she found that she's also doing acupuncture and and had another couple of modalities she would use. And she found that those horses run the BioPro Armour routinely, and I was amazed at this. She taught me a lesson. Those immune spots and acupressure and acupuncture sites decrease in their pain threshold. So we actually were changing the immune system actually apparently changes the immune threshold of these acupuncture and acupressure sites to the point where it'll help the horse reduce inflammation and pain, which I thought was a very interesting aspect. So
That is really cool.
yeah,
Makes sense though.
it does. And of course, people don't realize that the immune system is the basis for all of our healing and our health.
Yep.
Immune system basically regulates every organ system of our body. And when it's out of whack, especially when the cellular part of the system, which we're dealing with, goes down, we end up with called autoimmunity. And we see that in horses a lot with asthma. Asthma is a form of autoimmunity. When the immune system is down, they cannot handle those various insults, and it ends up with inflammatory airway disease, and then on to, which is a mild asthma, on to a stronger, more severe type of asthma, or even up to COPD, which is what we call broken wind, or horses basically has no energy reserve at all. So the immune system is most important, and it's a great adjunct to use with these other modalities we talked about. Also use shockwave and ultrasound on these horses with sore backs up in the sacroiliac joint. So there's a lot of different modalities. The main thing you have to do is decrease the pain and inflammation. And for me, the greatest one for the greatest percentage of healing and also depth of effectiveness is the PEMF machine. And of course, injecting with the counter irritant, those are also very, very effective. Injecting with steroids is good for an immediate response, but it decreases and destroys the cellular immune system, which we're trying to keep up active. So the body,
Yep.
that's why I quit using them, because I know it's detrimental to the immune system, and that's basically where I'm coming from. Is this day and age, the immune system to me is the most important thing we can take care of, and that horse and the rest of it will take care of itself. I hope these answer some of your questions.
Yeah, for sure. I think that back problems in general are a great reminder that a lot of issues in horses are also caused by like other underlying issues. Um, so how you were talking about, poor shoeing and poor saddle fit and things like that, or injury in the hock or things like that. Those are all those can all cause back pain, and it's a like great reminder to always, before, like, how do I say it, before trying to ultimately figure out what's wrong with a horse at any given time, just to look at everything to get the full picture, um because there's so many things that could be causing the issue.
Yeah, just as you were saying that, Bryanna, I I eliminated the stifle joint on the way up that leg. I forgot about the stifle joint. It's a
Yeah,
major, major cause.
that counts too.
Yeah, that's a major cause. And of course, if you're examining a horse that's going sore behind, uh, I can almost guarantee that you're going to have a sore back unless you get that soreness identified and corrected. That's the main thing. You got to correct those soreness problems below the back, and the back will a lot of times take care of itself. But yeah, it's a whole complex situation. There's not one thing that does it all. That's for sure.
Yes. That's what I was trying to say. Like, it's very everything is interconnected and complex, and it's never just like, oh, this is the problem. It might take you a while to figure it out, but it's usually more than one thing that ends up causing the pain.
Well, I try to simplify it. Here again, I could go on and on. The front legs also cause back pain. If you have a horse that's sore, he's taking all the pressure off his feet and he's putting the pressure on that sacroiliac joint. So that's another problem. You gotta look at the whole body. You got to get the whole body balanced and free of any inflammation, which is causing abnormal gaits. And when you do that, then you can attack the back pain and get rid of it. If you just try to get rid of the back pain without addressing these other problems, you're not going to be very successful. You got to do
At
everything.
least not long term.
Exactly. So,
And
in a nutshell, that's back problems are. We could speak here all day long on back problems. They're
yeah,
it's very
I
interesting.
think that's a good.
Every horse
I
has
think
its
that
own pain threshold, and some horses can run better with them, sustain that back problem than others. So there's that
yeah,
you got to take into consideration.
for sure. I think that's a good overview of everything, though. Maybe we can um look deeper into some of those things in later episodes. I also thought of an interesting comparison when you were talking about the tying up and how horses get the muscle spasms in their back. Because of my disability, I can also get muscle spasms, so like I know what that feels like to have that kind of uncontrollable feeling and like pain until the spasm goes away. So, and it really does affect how you're able to move because I know when my legs are spasming, I can't really move them very well at all. So,
Exactly. Well, you know what those horses are going through then firsthand.
yes, yes.
Uh,
I understand a lot of the, feeling of not being able to move properly or,
mhm. Well, it's a great life what we're doing and what we're going through. So
yeah.
hopefully we'll get some activity from your listeners and they can ask some of those specific questions they're having with their own horses and their backs and other
Yeah.
problems we can straighten out. So
Um, when I post this one, I can, ask specifically, if anybody is having any current issues that they're seeing that they want to ask about with their horses,
perfect.
to put them
That's
below
what we're here.
too. Maybe that'll entice people.
Hopefully that's why we're here. Try to help people with their problems.
yes.
Yeah.
We definitely want to do more of that, as much of it as possible.
Yeah. Well, it's an ongoing situation. We
For
just keep
sure, yep.
trying.
Well, thank you so much for your time, Dr. Warren. I really appreciate it.
Well, it's my
This was a
pleasure.
good this was a good short and sweet one. I'll
Well, it's
try to
great to
come
be
up with
with you.
some I'll try to come up with some more topics as well while I'm thinking about it. And thank you so much, everybody that tunes in to watch this as well. I hope you have a good morning, afternoon, night, wherever you are in the world. You can follow us on Facebook, Instagram, and TikTok at BioPro Armour. Our goal with these Ask the Vet videos is to eventually do live streams where we answer your questions live. So um, we would really appreciate your support on these. And I will post these videos as we have them available and invite everybody to post their questions. And thank you again for watching.
Bye.
Bye, Dr. Warren.